And currently, I'm working as a consultant and also as a conservative dentistry faculty with focus. So, okay, without much delay, we'll move on to today's topic, which is bleaching. So I'll start the screen sharing. Okay. The screen is visible, right? Okay. Can anyone give me a thumbs up in the chat box, whether it's visible or not? It is, right? Okay. My specialty is endodontics and conservative dentistry. Okay. So what exactly is bleaching? So bleaching is a very simple topic to start on, but it is a much important nowadays because the people are more focused on aesthetics and cosmetics nowadays. Okay. So what exactly is bleaching? Bleaching is lightening of the color of a tooth. Okay. So the application of a chemical agent to oxidize the organic pigmentation in the tooth. Okay. So bleaching as seen in the picture, it can be done to actually lighten the color of the tooth. Like if they are normally having a yellowish shade, it can be made a little more whiter shade by bleaching, or it can be also done in case of discolored tooth. Okay. So here we use a chemical agent. There are a few commonly used bleaching agents which is used to bleach the teeth, and these bleaching agent will actually act upon the chromophores, which are the color causing pigments, big organic molecules. They'll break them down into smaller light colored molecules. So that is exactly the that is said to be the chemistry of bleaching. Okay. So moving on. So bleaching is done in case of discoloration or in case of naturally yellowish teeth. So here we are discussing more about discoloration. What causes discoloration? So discoloration can be rectified, or it can be corrected not only by bleaching. There are many other conservative procedures also, like you have microabrasion, macroabrasion. Then you have little more extensive procedures like veneers, a bit more extensive procedures or invasive procedures like porcelain veneers, porcelain jacket crowns. So here, like we will be discussing about microabrasion and macroabrasion also in the upcoming slides. Okay. So discoloration, it can be due to some external cause like extrinsic factors, and due to internal causes like intrinsic factors, which is called intrinsic factors. So extrinsic factors include the plaque, okay, that the plaque on the teeth, then the food and beverages like colored foods which we take, tobacco use, then poor oral hygiene, gingival hemorrhage, and excessive use of chlorhexidine mouthwash, and metallic stains from medicines. Now, intrinsic stains means which are internally present, which are due to internal causes. So that can be which are present before birth, that is not before birth, pre-eruptive, before the eruption of teeth, which includes metabolic diseases like alkaptonuria, other diseases like hematological disease like erythroblastosis fetalis, sickle cell anemia, congenital porphyria, and diseases of enamel and dentine like amelogenesis imperfecta, dentinogenesis imperfecta, tetracycline, use of tetracycline drugs, and fluorosis. So tetracycline usage, okay, the use of tetracycline antibiotic is found as associated with too much of staining or too much of discoloration, and it ranges from yellowish orange to bluish black in color, and this is one of the most tough stains, okay, which is most resistant to bleaching. But bleaching still is an option for tetracycline stains. So tetracycline stains, they have a characteristic yellowish orange color to blue black color. This you keep in mind, because there are image based questions which have been asked regarding this discoloration. Okay. And then intake of excessive fluoride during the eruption, it can also lead to discoloration, tooth discoloration. Now you have post-eruptive causes, that is due to aging, age-related changes. Age-related changes means when you age, the teeth becomes more yellowish in color, poor oral hygiene again, pulpal changes. Due to pulp degeneration also, the color may fade. It becomes brownish to black in color. Then trauma, dental caries, restorative material like amalgam. Amalgam fillings causes discoloration, like amalgam blues, etc. Then functional parafunctional changes. So if you have functional and parafunctional, like you have habits, functional habits, bruxism and all, there will be yellowish color. There is a chances for more yellowish or darker side of darker shades to that will impart a darker shade to the tooth. So these are the most common causes. You have extrinsic and intrinsic causes for discoloration. So now for bleaching. So for bleaching, you have different materials which are used for bleaching. So the most common bleaching agents which are used are hydrogen peroxide, then you have the carbamide peroxide and sodium perborate. So these different chemical agents have been used for different types of bleaching techniques, which will be we'll see in the upcoming slides. Okay. So the most commonly materials like you have hydrogen peroxide, and different concentrations are used for different methods. So that's it about the materials. Now coming to hydrogen peroxide, which is the most commonly used bleaching agent. Okay. So a concentration of about 5 to 35% of hydrogen peroxide is used, and 30% of hydrogen peroxide is being called superoxole. Okay. So this reacts with the chromophores, and they result in formation of free radicals, which results in bleaching. Okay. Now, carbamide peroxide is another bleaching agent, which is used in a bleaching technique known as night guard bleaching, which is used in a concentration of 5%, 10%, 16%. So here also hydrogen peroxide again is the active ingredient. So it comprises of mainly 3.35% hydrogen peroxide, 6.65% urea. So this question have been asked: what is the percentage of what carbamide, the constitution of what constitutes a carbamide peroxide? So that comprises of 3.35% hydrogen peroxide, 6.65% of urea. Now, the third bleaching agent, which is commonly used, is sodium perborate. So it is used in another technique, which is called the walking bleach technique. So we will be having a brief discussion about all these techniques, not in detail. So in detail, we'll be discussing all this in theory classes. Okay. So we'll just have a brief discussion about what are the different bleaching techniques mentioned here. Then sodium perborate again, the active ingredient is hydrogen peroxide. Then you have the McKean's bleaching agent, bleaching solution, which is used for non-heat related bleaching procedures. Okay. So it consists of 5 parts of 36%. So you just have to remember this composition. McKean's solution is 5 parts 36% HCl, 1 part 0.2% ether, 5 parts 30% H2O2. Then you also have the modified McKean's, which is 1 part 30% hydrogen peroxide, 1 part 0.2% ether, and 1 part 20% sodium hydroxide. You don't have to bother about these numerical values. This will all be provided in the notes. Okay. So this is regarding the McKean solution. This also is being asked. Okay. Now let's move on to the different bleaching techniques. Okay, so we have dealt with what are the causes of bleaching, then what are the different bleaching agents used. Now we have vital bleaching and non-vital bleaching. So what is non-vital and vital bleaching? Okay, vital bleaching means the bleaching which we are doing for the vital teeth, that is a normal teeth which is not necrotized, which is vital. Okay, then you have the non-vital bleaching. Non-vital bleaching is primarily indicated for necrotized teeth, which has been root canal treated. Okay, so vital bleaching, again, there are two types of vital bleaching, two methods of vital bleaching, which is in-office bleaching. As the name suggests, in-office bleaching is done in the office or in the dental clinic, and home bleaching or the night guard bleaching, which is done at home. Night guard, we use it during the night time, so you can remember it like that. Night guard bleaching or home bleaching. In office bleaching is done in the dental office. Then you have the non-vital bleaching, So first we'll move on to the vital bleaching. So in-office vital bleaching, how is it done? Okay, so first you have every procedure has to be done under rubber dam isolation, because bleach is very corrosive. So if it comes in contact with soft tissues, it will lead to burns. So rubber dam isolation is a must. Then you apply 30 to 35% of hydrogen peroxide. So different compositions of different combinations on different manufacturer provides it in different forms. So it is available. So this is applied onto the tooth surface, isolated teeth, and then it is placed onto the tooth surface for 30 to 45 minutes. Okay, and after that the bleaching agent is removed, cleaned, and the tooth is, and if any sensitive issues are present, an anti-sensitivity agent is applied. So that is how in-office bleaching is done. Okay, and power bleach is something like if you add on a light activation to it, or a heat source to it, then it is called power bleach. So again, there are also other modifications. Again, all this cannot be dealt in this a few hours allotted, I mean a few minutes allotted to me. So this all will be discussed in detail in your classes. Okay. Then you have another method of home bleach. So home bleach, what you do is, a different kind of agent is used. Here carbamide peroxide is used, 10 to 15%. So here a tray is fabricated, an impression is taken, and with a spacer. A tray is fabricated. The bleaching material is placed onto the tray, and you have to wear it at night. Okay, for 4 hours, minimum of 4 hours, it has to be worn. And even though the concentration of bleaching agent is less, and the result is slow in this home bleaching, it appears to be more sustaining than the in-office bleaching. Okay, so these are the two kinds of vital bleaching. We have the in-office method using hydrogen peroxide. Then you have the night guard bleaching, or the home bleach using carbamide peroxide. Okay, then we move on to non-vital bleaching. So on hearing non-vital bleaching, you should remember that this is done strictly primarily indicated for non-vital teeth, that is root canal treated teeth. So root canal treatment is a must for this kind of bleaching. So it is mainly indicated for to lighten endodontically treated teeth. We know that the tooth subjected to trauma or pulpal degeneration might be discolored, might be darker than the normal teeth. So after root canal treatment, we do non-vital bleaching so that you get a lighter shade. If the tooth structure is sufficient, doing just a non-vital bleaching and filling it with a composite restoration might be sufficient. Okay, rather than going for a crown. So it is a conservative approach. Okay. Then the most important thing for non-vital bleaching is you have to provide a barrier. Okay, before you place the bleaching agent, you have to provide a barrier, and then you have to place the bleaching agent in the coronal part of the tooth. Already there will be a GP material with GP which is filled in the root canal. So 2 mm apical to up to the CEJ from the coronal portion, it is removed 2 mm. Okay, only 2 mm is removed, and after that the bleaching material is placed. It is placed for about a few days, like 48 hours to 1 week. So again, for non-vital bleaching, there are two different types, which we'll be dealing in next upcoming slides. So another important problem of this non-vital bleaching, the side effect is that it will result in cervical resorption. So a method to overcome or to prevent cervical resorption is to provide a proper barrier, and the barrier which has to be given is should be of RMGIC. Okay, again RMGIC barrier is to be given. Now the thermocatalytic method of non-vital bleaching, or the in-office non-vital bleaching, is again you remove a bit of the coronal part, you fill it with the bleaching material. Okay, and again a heating material, some heating material is placed in the chamber so that acceleration to the bleaching process is obtained. But this method is not advised nowadays. Thermocatalytic bleaching is not advised nowadays because there is a high risk of cervical resorption. So again, to prevent this cervical resorption, what we do is we put a mixture of calcium hydroxide and water, a slurry. So it will prevent cervical resorption. So that is how it is done. So this is how it is done. You place the bleaching material inside and use a heating instrument to heat it, so that it accelerates the bleaching process. But again, this thermocatalytic method is not advised nowadays because of high risk of cervical resorption. Okay. So the second method is walking bleach, which is the most commonly practiced method. Here, sodium perborate is used. It is relatively safe. So here, a GP is made, as shown in the picture, you can see a GP is removed from 1 to 2 mm apical to the clinical crown. It is clearly seen in the picture. 2 mm of GP is removed from the coronal portion. Then again, the bleaching material, sodium perborate material, is filled inside the coronal chamber, and it is a temporary filling material is placed. You wait for 24 to 48 hours. The patient can go home, or it may even take 7 days or 1 week. And the patient come back, see the color change. And if you're happy with that change, then you give a permanent filling. If it is not, then you opt for a permanent filling. And then if it is, the color is not as desired, again you go for a second or third or fourth, how much ever times it will, the time will take to cause the remove the discoloration. Okay, that is how walking bleach is done. So that finishes bleaching. So again, we have the another conservative method to treat discoloration, that is the microabrasion. So what is microabrasion? It is a dissolution of an enamel by an acid, followed by polishing with pumice to remove superficial stains or defects. So this was an older concept. Okay, so before, what happened? What the first initially 18% hydrochloric acid was used, followed by polishing with pumice. But this concentration of acid was found to be too corrosive, okay, too strong. So it was again modified by, this method was given by Kroll, Theodore Kroll. Again, this was modified by Kroll by giving 11% hydrochloric acid concentration with, by replacing, and again replacing pumice with silicon carbide particles. Okay, so this formulation is used in the present compounds which is used for microabrasion, commercially available products like you have the Prima compound or Opalasture by Ultradent. All these combinations, you have 11% HCl with silicon carbide as the abrasive particle. So that is microabrasion. So in microabrasion, you use an acid to etch the enamel, to cause the enamel dissolution, then you polish the tooth. So for microabrasion, it is usually used to treat enamel stains. It is used for mild decalcification defects. It is not used for deep stains. It cannot be used to remove deep stains. So it is used for mild decalcification. Especially you can use it in areas like after ortho treatment, you have decalcified areas if your oral hygiene is not proper. So in such cases where there are decalcified areas, you can use microabrasion. Okay. Now, another thing is macroabrasion. So micro is in the micron level. You macroabrasion. Here the difference is you use a burr. You use a 12-fluted burr, composite finishing burr, or a 30-fluted composite finishing fine and finishing diamond burr. Okay, that is what macroabrasion. And the difference between microabrasion, you use an acid and an abrasive agent. In macroabrasion, you literally, it is a physical process. You do it with a burr, 12-fluted or 30-fluted composite finishing burr. I hope the difference is clear. Okay, so that finishes the theory part. Now we move on to the most interesting session, that is a questions will be discussed. And in this part, I expect your active participation. I want you to just put the answers in a chat box. Okay, I want everyone to participate. The questions will all be from the areas which I have covered. So I just want to know how many of you have been attending it properly. Okay, so let it be wrong. You can just be confident and go ahead with your answers. Okay, it's not a problem. You learn from your mistakes. Okay, so the first question will be, what is the modern approach treatment of a discolored crown? Answer A is option A, composite restoration, full crown, bleaching, implant. So come on, tell me the answers. So I want your answers. I won't be giving you the answers without you. See, yeah, that's an easy question, right? Yeah, very good, everybody. Safina, yeah, everybody. Answer will be C, bleaching. So discolor crown can be treated with composite restoration, but here the most apt modern approach will be bleaching, because composite, again, you have to remove a lot of like, it is a composite restoration and not a composite veneer. So again, you have to remove a lot of tooth structure, etc. And full crown will be too invasive, and implant is not an option at all. So the answer will be, the most apt answer will be bleach. Answer will be bleach. Okay, very good, everyone. So we move on to the next question. Okay, this I have mentioned in the notes, I mean, in this discussion. So the most common complication of bleaching non-vital tooth is A, apical periodontitis, B, cervical resorption, C, discoloration, and D, resorption, root resorption. Yes, Jasi, Reja, Raju, all are right. Yes, very good. Cervical resorption is the answer. So the most common like complication of the non-vital bleaching is definitely cervical resorption. This is how it is seen. See, you can see here radiolucent areas. So this is how what happens if the seal is not proper. So cervical resorption is the most important, the most common complication of bleaching non-vital tooth. So another add-on is what might be the, can anyone give me the answer for this question? That is, what is the most important complication of vital teeth bleaching? Anyone to answer? Anybody? Non-vital tooth it is? Nobody? It is cervical resorption. Okay, so the answer for the, yes, some are answering. Let me see. Come on, yeah, let it be wrong. It's fine. Sensitivity. Why not composite map? It is given as composite restoration before question. So composite restoration is not actually a better option. So when you're given a choice, when you're given some choices, you should be giving the most appropriate answer. So the most conservative and the most appropriate one will be bleaching. Composite direct veneers will be okay, fine, you can but composite restoration is not an option for discoloration. It is a more extensive procedure. Better is to go for bleaching. Okay, sensitivity, Dr. Faisal, sensitivity is not the answer, but your it's good to attempt. Okay, answer will be apical periodontitis. For vital teeth discoloration, the most vital teeth bleaching, the most common what do you say, the complication is apical periodontitis. Okay, so we'll move on to the next question. I want Sujay Singh, everybody to answer, like Srinivas, Dr. Srinivas Kumar, whoever, just post your answers. Okay, don't think whether it will be right or wrong. So this is you make mistakes, and that's how you learn. So it will be more interesting for me too. Okay, okay, we'll move on to the next question. Tooth whitening strip is hydrogen peroxide, H2O2, hydrogen peroxide, uh, hydrofluoric acid or hydrogen fluoride, carbamide peroxide, sodium perborate. So this, the answer would be, any guesses? Yes, very good. Very good. Very good. Raja Raju, Dr. Sharata Devi. Yes, answer will be hydrogen peroxide. Hydrogen peroxide strips. So this is, the tooth whitening strips have been introduced to replace the bleaching trays. So bleaching trays, it takes a lot of time, right? So for bleaching, what you do is we use a smaller, milder concentration of hydrogen peroxide, like for 5 to 14% you use. And these strips are bonded onto the anterior tooth surface. You keep it for about an hour. So active ingredient, which is hydrogen peroxide, is released, and it causes and it results in bleaching. That is how a tooth whitening strip works. So it has been introduced to actually replace the uh, tooth, bleaching trace. Okay, so here the tooth whitening strip is mostly hydrogen peroxide. So which is the bleaching agent used in home bleaching or the bleaching with tray method? Answer me. Which bleaching agent is used? Is it hydrogen peroxide? Is it carbamide peroxide? Is it sodium perborate? Come on, I want to answer this to this question. Which bleaching agent is used in home bleach? Yes, very good. Yeah, yeah, very good. Carbamide peroxide. Very good. Okay. Okay. Now, next question is about home bleach. Um, all these are true for home bleach except it's a dentist prescribed home technique. Okay. It contains 10 to 15% carbamide peroxide. And bleaching both arches at one time is preferred. Patient compliance is needed. So, what do you think might be the answer to this question? Is it a dentist prescribed home technique? Yes, yes. It contains 10 to 15% carbamide peroxide. Bleaching both arches at one time is preferred. Patient compliance is needed. Now, the answers, very good. Bleaching both arches at a time are not preferred. You only you only apply the bleaching tray to one arch at a time. Okay, so that is the answer. Answer will be C. Okay, so this again I have mentioned. Cervical resorption after bleaching is prevented by application of dash and water. Here the water is not given, but the material which I had mentioned is clearly given. What material do you use actually to prevent internal resorption? Just think like that. So is it 80% alcohol drying immediately after bleaching? Alpha tocopherol applied immediately after bleaching, sodium perborate plus sodium hypochlorite, sodium perborate plus calcium hydroxide. Okay, let me see who all have this. Manjusha has told it as C, sodium perborate and sodium chloride. No. Yeah, very good, Dr. Anila. Answer is sodium perborate plus calcium hydroxide. Yes, that is the answer. So calcium hydroxide itself, it stops or it inhibits the internal resorption. So a mixture of actually calcium hydroxide and water is placed as a slurry. So this method is clearly given in study events. Okay. So more details will be discussed later because everything can't be provided. There are like limitations. Okay. So the answer would be D. Okay. So this I have not mentioned. A composite restoration is to be done in case of bleached tooth. Okay, the maximum bond strength will be achieved when the composite is done after 1 day, 1 hour, 2 weeks, 1 week. So immediately after bleaching, what happens is we know that a lot of free radicals are produced. The basic chemistry of bleaching is the production of free radicals, and these free radicals act upon the colored molecules or the chromophores, break it down to smaller molecules. Okay, so these free radicals, what happens? We know that composite restoration or composite is bonded, or composite is bonded by polymerization reaction. Okay, so here it is also a reaction which involves the free radicals. So this will, in these free radicals already present at the time of bleaching, will interfere with the polymerization reaction of composite. So what happens is, if you try to give a composite restoration immediately after bleaching a tooth, what happens? The bond strength will be very less. Bonding will not properly take place. Okay, so what can be done is, either you have to delay your restoration for a minimum of 1 week. Okay, so the answer, let me see who have given the answers. Anybody has given right answers? It's not 1 day, it's not 2 weeks. A minimum of 1 week should be given. Okay, the right answer will be D. So a minimum of 1 week should be given before giving a composite restoration. If at all there are new concepts which says that there are methods, okay, there are methods where you can apply some agents. agents. Some agents can be applied, which after which you can immediately do the composite restoration. But on a normal basis, or in a normal composite filling, normal case scenario, you have to give a minimum of 1 week before composite restoration is done. And the reason I have already explained. Okay, I hope it's clear. So the answer will be 1 week. Okay. So macroabrasion. What is macroabrasion? What is a macroabrasion? Is it removal of localized superficial white spots and other surface stains or defects? Treatment of deep discoloration with tetracycline stains? Treatment of discolored endodontically treated teeth? Treating any discolored anterior teeth? What might be the answer? Yes. Everybody has got it right. Answer is A, removal of localized superficial defects and other surface stains or defects, superficial white spots. So macroabrasion cannot be used for deep discolorations. Keep it in mind. Okay. And macroabrasion, what do you use? You use a burr. Okay. So the mechanism of action of carbamide peroxide in bleaching. I've already given you the answers. Anybody? Is it formation of sodium perborate in water upon heat? Formation of hydrogen peroxide on contact with saliva? Formation of sodium peroxide? Carbamides upon breakdown of carbamide peroxide? Hydrolysis of peptide bonds on contact with tooth surface. Don't make it too complicated. Just the formation of hydrogen peroxide. So the active ingredient is again hydrogen peroxide, even in carbamide peroxide. So the answer will be C. I hope everybody has seen, no? Yeah, B, right. D is not the answer. It is B. Okay. Now, microabrasion. Very simple, direct question. Microabrasions involves the use of sulfuric acid, acetic acid, phosphoric acid, hydrochloric acid. Now, I want you all to post the answer. I'm sure that all of you might be knowing the answers. Yes, it is hydrochloric acid. What is the percentage of hydrochloric acid? Not the modified one, the before one. Very good. Yes, it was 18%. Initially, what the crawl introduced was 18% with pumice. Now the percentage is, now what is the modification done? Very good. It is 11% with, what is abrasive used? Abrasive used, anybody? Modification? It is silicon carbide. Okay, never mind. It's okay. But you have answered pretty much. It's nice. I'm happy. Okay, now let's move on to the image-based questions. So nowadays, NEET is full, like you have a lot of questions which are image-based. So what I have to tell you, I want to tell you people is that if you can't read or you can't just finish off the reading your textbooks, just go through the pages, just go through the images, just read what is given as headings. Okay, because a lot of questions, image-based questions have been asked. So you make it a point that you go through the images of standard textbooks or whatever textbooks you are referring. You have sturdy events, you have whatever textbooks you are referring. Just go through the images, important images, and at least something will it will strike you at that time. Okay, so image-based questions are very important nowadays. It has been asked. So tell me, what technique is this? Okay, I can give you options. The A, macroabrasion. Is it microabrasion? It is air abrasion or bleaching. What is this procedure? You can see stains here, brownish stains. Here you're applying some material and then you are polishing it with something. Okay, and then later you're polishing it with a polishing paste. You're braiding it with something, later you're polishing it with a polishing paste. So what is this procedure? No, it's not macroabrasion. So it is not macroabrasion. Macroabrasion, what you have to remember is there will be a burr, use of a burr. This is not a burr. This is a polishing cup or a rubber cup. Okay, here there is a abrasive used. So what might be the answer? You are using an abrasive here. So is it macroabrasion or microabrasion? Yes, it is microabrasion. So now let's move. It will be clear when you see the next picture. So if you get a picture like this is microabrasion. Okay. Now what is this procedure? You have hyperplastic patches. You have hyperplasia, plastic teeth. Here you are resurfacing it with some burr, finishing burr, and this is the result. So what is the answer? What is this procedure? Is it microabrasion, macroabrasion, polishing, or what is it? This is macroabrasion. Okay, very good. Manjusha, Jassi, um, Sarada Devi, yeah, everybody. Yeah, this is right. This is macroabrasion. So don't mistake it with microabrasion. Microabrasion, you have a polishing agent, you will be seeing a polishing cup, etc. So if you see a burr, it is macroabrasion. Okay. What kind of stain is this? So I have mentioned about the stain. Okay, these are bluish black colors. These are seen as bands. This is very resistant to bleaching. Okay, so this stains are what kinds of stains are these? Can anybody give me an answer to this? Very good. Dr. Anila, very good. Tetracycline. This is the typical feature of the tetracycline stain. So in tetracycline staining, you get yellowish orange to bluish black color. Okay, and they are very resistant, but still they respond to bleaching. Okay, they might respond. Sometimes there might be cases where you have to do internal bleaching and external bleaching. And in some cases, all these phase you'll have to go for porcelain jacket crowns. Okay, so that is it. So that finishes my presentation. I hope you have gained some knowledge about bleaching. Okay, if you have any doubts, you can just post it in the chat box. Then okay, I have not covered the entire portion because there are a few more areas to cover, but everything is not possible in an hour. Okay, so this is just more details will be provided in the theory class, discussion notes, everything will be provided. So this is just a brief to the topic. I mean, this is just introduction to the topic. You're welcome. Thank you. Thank you all. Thank you. Thank you, Dr. Anila. I'm happy that all of you have like actively participated. So keep striving hard and study well. Thank you. You're all welcome. And thank you for being with me. I think all of you have who have joined with me in the beginning. All of you are there, still there, even the end of the session. So if you have any doubts, you can just ask me, or we'll just wind up. Okay. So in that case, shall I leave? So all the best to everyone to study well. Okay, that's all. Okay, bye everybody. All of you have a very good night. Bye.